So let's hear from Sam Rose, who's the acting director of the UN Agency for Palestinian Refugees, UNRWA, which Israel officially banned last year. He says Israeli restrictions are still preventing them from bringing food and medicine into Gaza.
UNRWA alone has enough food outside of Gaza to feed people for 3 months. That food needs to be able to get into Gaza, and we need to be allowed to distribute it safely. There's too much at stake to not allow us to do that. The Israeli laws do not impact on our ability to distribute supplies inside of Gaza. And we call on member states that have influence in these matters to allow us to get on and do our jobs. Things have been allowed to carry on for too long, and they've reached such a desperate state now. We need to be able to get on with this. What we're able to bring in depends on the conditions in which we are able to work. We showed during the ceasefire that we can bring in 500, 600 trucks a day. In the conditions that we're operating now, the numbers will be far lower than that, but there'll be more than we were able to bring in, but not enough to fend off and reverse these horrific trends of starvation and malnutrition amongst children. And we also have to remember that it's not just food trucks, it's not flour that's going to save children's lives. These children are so desperately ill now, they need specialized treatment. They need parents who are able to take them for that treatment in health clinics, who are able to do that because they're not living in fear of constant bombardment. They're not constantly facing displacement and moving from one place to another. So yeah, this is a start. More needs to be done. The UN system, the humanitarian community at large, is able to deliver in dignity and in safety at scale. We've shown this countless times over the past 20 months, and indeed over the past 75 years. We are ready, able, and willing to do it, and we need to be allowed to do our jobs.